Hello and welcome, my friends. I'm Dr. Saptarshi Banerjea. I have a very interesting session coming up on this weekend, Friday and Saturday, which is 17th and 18th of this month. I'll be sharing very interesting clinical tips, ancestral clinical tips over the 5 generations on different dermatological conditions. I'll be sharing with you psoriasis. I'll be sharing with you acne. I'll be sharing with you fungal infections, which is a common problem. I'll be sharing with you ringworm as well, and I'll be sharing with you boils. And if you try and understand these factors many times from the repertorial analysis, sometimes you may fall short or you are falling behind and you are unable to crack those blocked cases. I'll be sharing with you very interesting clinical tips where you can look at the skin and come up with a prescription. Those who have attended my part 1 on dermatology, I've shared with you different pictures of different patients of different conditions where you can look and diagnose the skin and come up with a prescription. Similarly for psoriasis, similarly for fungal infections and acne, I'll be sharing with you different pictures where my understanding is you prescribe on what you see. You look and diagnose, you put on that understanding, and you can definitely come up with a prescription. I'll give you a few simple examples. When you come across the psoriasis where there's a lot of back blackening, where there's a lot of cracks, definitely graphitis will come in your mind. I'll share with you 3 different medicines for blocked cases of psoriasis, which I've learned as an ancestral tip: Stevia, X-ray, radium bromide, and I'll be sharing to understand the comparative differences. So I hope you'll not miss out on this opportunity to learn the other way of prescribing, which is on prescribing on what you see. Look and diagnose, but it's always obviously simple, classical, practical homeopathy, which you'll be learning.